Candyce Paul from English River First Nation at La Plonge Reserve, number 192. Across the Beaver River Valley from Beauval.
Also,
Well, I think I have to step back all the way to 2015 when we had the big forest fires and the whole 13,000 people from the north, which is 3/4 of the population, were evacuated out of the area, and nobody knew what they were doing. And the struggle was pretty hectic. Everything was pretty unorganized, pretty hectic. We didn't know who to contact, what to do. We were learning on the fly, and we did it. We managed it, and one of the big things that came out of it was communications to our people, to keep people calm, to keep people informed. The more they knew, the more less stress they had, and the easier it was to deal with. So going forward, we teamed up with Beauval, and we took some incident command training and prepared ourselves for anything that came along. English River First Nation in the interim took also with MLTC and PAGC had trained a few people for incident command. They and started developing emergency response plans. And one of the emergency response plans that English River developed was the pandemic response. And having that in hand when this pandemic hit really helped. It helped our community and it helped the entire region because we shared what we had with the entire region, starting with Beauval. And from there, we put out a regional response because we found that, because the north is pretty much, especially our northwest region anyway, we're pretty much all related. Our communities have relations between them. They have families between them. It's important to keep that in mind. So, we have members living in many of most of the other communities. So keeping everybody informed was an important part of it. And what we found out too was that a lot of the leadership in most of the municipal communities had no information whatsoever. Nothing from the government of Saskatchewan. And I think this was pretty uniform across most of the smaller municipalities in the province. They didn't get information, just what they heard on the news. Dealing with this area and the gaps we have in medical services compared to the south, businesses, we went everything from what do we do with the garbage to what do we do with bodies, not knowing at the time how serious this was going to be. So we developed plans for every aspect of this. And in hindsight, we're fortunate that we didn't need to use many of those plans, but it could have been something that was a lot worse, in which case we were ready. So consequently, English River and Pachinak, they kept their arena shut because of the artificial ice in there. It would have provided, a frigid place to store bodies if they had to. But most of the communities would have had to go to, freezer trucks to do it. So those were the kind of things that got started. And then one of the big things that we developed a regional response and pulled everybody together, and based on the fact that we had people in place like yourself who knew how government works and had contacts, the mayors had contacts, we were able to pull in all of those agencies that we needed to deal with this pandemic. So, when it was first started and there was no PPE, between the tribal councils and the Métis Nation, we were able to get PPE. We were in a unique situation because NITHA which is the Northern Intertribal Health Authority that looked after the First Nations. We're also providing a lot of services to, especially to the First Nations. We have two jurisdictions to deal with when it comes to health, and that's the Saskatchewan Health Authority and the Northern Intertribal Health Authority. Most of the communities, First Nations communities, have sister communities that are Métis communities, and vice versa. And most of the First Nations handle the health services for their sister communities. Whereas the jurisdiction we're in, our little First Nation at La Planche is serviced by the Saskatchewan Health Authority. Part of the challenges with that were nobody knew who was going to be in charge of looking after us. On the First Nations, they did the monitoring of all of the people, whether they were living in the reserve or the adjoining community. Whereas for us, NIFA didn't know that we were part of a reserve because we've always been looked after by SHA, and SHA wasn't monitoring us. So anybody who got sick here, we were stuck. So consequently, there was a lot of stuff going on where we even had to have somebody detained and sent to the COVID detention center who wasn't from our community but was running around spreading COVID. So I had to go through all kinds of channels to get that dealt with. One of the things that as a region we offered to SHA though was to do help with the contact tracing and monitoring. And immediately barriers went up. No way could we do that. There was, no way could we be trained to do that. You had to have some sort of health background to do it. And eventually they were overwhelmed and couldn't handle it. And what did they do? They simply stopped doing contact tracing, which aided in spreading in the final 2 waves that we've had. With no contact tracing, there was no way to prevent anything from spreading. So there were huge challenges with the government. I wouldn't say necessarily with the medical health officers. The medical health officers went over and beyond in both NIFA and SHA in our region to assist with everything we needed to know about COVID. And through that, we were able to communicate that to our communities. At one point, there was 11,000 people reading our daily communications. And considering there's only 17,000 people in our region, that's a lot. Pretty much all the adults were reading it. Also, I know the media were reading it because they weren't getting the same information from outside MHOs as we were. And it helped a lot. It really helped a lot. I think, yes, in our communities, every community struggled with mental health issues because of isolation. But we were able to say, look, in the past, we have had to be strong through things we still have to be. We have to look after our vulnerable people. Because when, this started, we started looking at our chronic lists. Every fire season, we have to create a chronic list, right? And the number of people, over a third of our population, has got chronic health conditions. So all of those people were and are still at extreme risk. Those are the ones that COVID is taking out. So another big concern that we harped on right from 6 months in was long COVID, the long-term effects of COVID. And this is not the first virus that has had long-term effects. If you look at polio, Anybody who survived polio had long-term effects that affected them throughout the rest of their lives and affected their quality of life. COVID is another one that will do that. We have, they figure about 30% of the people that have had COVID, will have some sort of long-term health impact. Um, People that are suffering, people are showing up with effects 6 months to a year after COVID with things like diabetes, um, heart disease, all kinds of things that they wouldn't have contracted if their systems hadn't been attacked by COVID. So that was the one thing that, there still isn't enough information on. We are working at advocating for getting more information, getting more research done, getting local research done rather than dependent on, big outside systems. Because as First Nations people in an area this size, with already having some health impacts from the colonization, the changes, the environmental impacts, our immune systems are weakened already, and it's affecting our people. So this is going to be something we have to deal with going forward too. Like all of the people who have had lung issues because of COVID are going to have lung issues when it comes to smoke during our wildfire seasons, and climate change is going to be creating more of those kinds of seasons. That's going to be common. And it's one of the things that we're doing in English River is we're purchasing portable air purifiers to be handed out to anyone who has cardio or lung issues, so they can shelter in place rather than be moved and go through the stress and anxiety of being away from home. It's also a lot more expensive to be away from home. So this is one effort that we are currently working on and hope to have in place before we actually have smoke. So, as an emergency response overall, we'd like to see more training in every community. We'd like to see permanent positions in every community where people can be prepared ahead of time to deal with emergencies, all types of emergencies. During COVID, we had to deal with flood in this valley even. And there was a lot of things that, you have to take into consideration. If that road had gone, our whole getting emergency medical services up here would have taken over 3 hours to get it to Pachinak with an ambulance from La Ronge, which is unacceptable. That's way too slow. Our little community here has no airport. We don't even have a gas station on the reserve here. If we'd have been cut off from the other side of the river valley. So one of the things we did was contact the resort at the lake, knowing that he had some large gas tanks because he provides gas for his boats, for his tourists. So he agreed to get more gas in. So in case we had to move people even further for any reason, or people had to go get groceries for any reason, they wouldn't have had to go as far, wouldn't have been stuck. So those are the kinds of things that you have to look at. You have to be able to think quick. You have to be able to think outside the box. And one of the things we really found out during that first year of COVID was the province didn't have our back. We as an entire region asked the province to keep tourists out of our region because we had limited supplies, we had limited food sources, we had limited health services. We don't even have enough for our own people. And for the health services, to deal with monitoring people that were transient, coming in and out of our communities and region, would have been a nightmare. And what they did instead was lock us in. And at a time when our main grocery store in the region had been shut down because of COVID. 6 staff had COVID. And therefore, we had no food. And there wasn't enough time for the other stores in the region to get food. Plus, there was an intercommunity ban on travel. We couldn't go to another community to get food. Yes, they switched it. They locked us in right at a time when it was pension day, it was social assistance day, and our grocery store was shut. And they were preventing our people from going and getting essentials. And then it got really nasty politically, and really, it's honestly racist, with the influence that that decision had on other businesses in the South. There was a lot of there was a lot of discrimination. People were, if you're from that Northwest region, we don't want you here. You're all like lepers. When in reality, COVID that came to the north came from outside the region. The first cases came from the man camps and spread from there. And that was one of the big concerns that we had, was, because a lot of our people there's people within all of our communities that work in those remote camps. And we don't know how they were handling things up there. And it did spread through quite a few of those camps quite badly. So, keeping, the security going, security was a good idea. It worked. It did help. It did help lower the risk of the spread of COVID in our communities, and it was a key factor in that aspect. It was hard on people in the communities, though, to have all of their relatives not being able to visit, and that whole not even having visits within the community. And I have to give kudos to our community members that followed through with doing that. It really spared a lot of people. It really did.
Yeah, when we noticed the variants changing, there was, I'm not sure if it was the fifth wave with the Delta that really created havoc. And I guess these variants aren't done with us. So this is where the challenge is now. It's left to the individual. The government's completely backed off on any kind of measures or monitoring.
Correct.
So this is where we're going forward now, unknown territory. But what can you offer for advice for our families?
Be careful. Continue to wear the masks if you go out anywhere. It's absolutely key to protect yourself, because we don't know what the next variant's going to be like. The Omicron one was relatively mild for most people, but just continue to be extremely careful. Avoid big gatherings. It's not worth it. And we know when Omicron hit, it took out a lot of our staff. It was really hard to keep things running. We have limited numbers of people who can step into a position to do a job. And if all of those people are sick, we're kind of on hold for everything. So, we don't have any political support now. to deal with this COVID, deal with this pandemic. As far as the politicians are concerned, it's economics as usual. That's it. That's all we can do. And individuals are just tired. I know you are. It's difficult to be that vigilant that long, but we still have to. We still have vulnerable people. The children are still vulnerable, especially. And children are also getting long COVID. And this is not something I wish on anybody. Um, be prepared. Be prepared to continue to be vigilant. It's not a it's not over till it's over. This virus doesn't care. It doesn't care one bit whether or not we let our guard down. We let our guard down. We're open. We're wide open for it. So, a lot of people who have long COVID got regrets. They really wish they'd been more careful. And you pass it on to a family member who gets the long COVID. That regret is heavy duty. Or who dies, it's heavy duty. So, honestly, though, one of the things about the government not keeping track of anything is, unfortunately, we are never going to know the full impacts that this pandemic has had. We're not going to know exactly how many people it took out. We're not going to know exactly how many people have long COVID and whether they're going to be able to get disability even to live out throughout the rest of their lives with that impact that from that COVID. It's up in the air. I'm hearing rumors there's not going to be disability for those people, but I haven't got that confirmed yet. So I'm encouraging people to still keep testing. The rapid antigen tests are still available before you go visit people who are vulnerable. And just make sure. It's better to make sure than not know that you're carrying or that you've picked it up. It's not that hard to do the test. So go for it.